Hi, today you will learn about health informatics and what the field of health informatics has to offer. Our presenters are V. Doe, Kendra Bruno, Kaylee Parks, and Janet Bolin. What is health informatics? Health informatics is the field of information science concerned with management of healthcare data and information through the application of computers and other technologies. Health informatics is also known as clinical informatics or medical informatics. Health informatics also expands to health information technology, also known as HIT or Health IT, and Health Information Management or HIM for short. Health IT is the application of computer and technology in healthcare settings, and HIM is traditionally focused on paper medical records and coding. Health informatics history. The field of health informatics began sometime between the 1950s and the 1960s, but was only recently recognized as an important aspect in the medical field. Over the years, the constant increase of medical knowledge and patient information resulted in new medical discoveries, thus creating more information. With the increase of information, there was a need to share, coordinate, and access medical information at any time of the day. Health informatics was the solution that allowed medical professionals to record, share, store, analyze, protect, and access the large amount of medical information. But too much information in the medical field can be a bad thing. Health informatics enabled health information management professionals to gather and analyze large amounts of data into useful information. There is an information hierarchy that is important in the field of health informatics. See the pyramid? Notice that there is more data than information, knowledge, or wisdom. As data is taken and analyzed, the amount of knowledge and wisdom produced is much smaller. Let me briefly explain what each of these levels mean. Data are symbols or observations reflecting differences in the world. There is no meaning associated with data. For example, the 10 could represent 10 fingers, 10 minutes, or have no real meaning at all. Modern computers process data accurately and rapidly. Information is useful or facts drawn by humans or computers. 10 fingers has the meaning that it is the number of fingers for a normal human. Modern computers do not process information. They only process data. Knowledge is information that is considered to be true. For example, an increase of flu cases to epidemic level suggests an increase of hospital patients. Wisdom is the critical use of knowledge to make intelligent decisions or to work through situations. A rising epidemic level of the flu could mean current flu vaccines are failing and a new vaccine must be developed. Health informatics provides the tools to generate information from data that clinicians and researchers can turn into knowledge and wisdom. What is HI's focus? Health informatics emphasizes the sharing of a variety of information back and forth between people and healthcare entities. Medical information includes lab results, X-ray results, medication allergy status, consultants' notes, hospital discharge summaries, etc. The field of health informatics is a mixture of other fields such as health sciences, computer sciences, biomedical engineering, biology, and business and management. Health informatics can also tie in with law. As new methods of administrating care are developed and technology continues to evolve, the law also has to evolve. Health Insurance Portability and Accountability Act, HIPAA for short, regulates concerns with confidentiality and security of patient information and steps to maintain privacy in the digital world from unauthorized access and use. Potential careers for a health informatics professional. With an associate's degree in health informatics, you can become a registered health information technician, medical transcriptionist, or a data entry specialist. With a bachelor's degree, your options are registered health information administrator, informatics nurse specialist, or a systems data analyst. With a more advanced degree, there are multiple positions available, like a certified health data analyst or an informaticist. A master's degree in health informatics, clinical informatics, or medical informatics can also lead to an executive position like Chief Information Officer. CIOs will typically develop a strategic IT plan and help with implementation of technologies in healthcare settings. Health informatics has many organizations. Some major organizations include American Medical Informatics Association, Healthcare Information and Management Systems Society, American Health Informatics Management Association, and so on. A common goal for most of these organizations include improving healthcare through information technology.
What is the privacy rule? In accordance with HIPAA, the U.S. Department of HHS, or also known as Health and Human Services, created the privacy rule. The official name for the privacy rule is called the Standards for Privacy of Individually Identifiable Health Information. According to HHS.gov, the privacy rule establishes a set of national standards for the protection of certain health information. The major goal for the privacy rule is to assure that individuals' health information is properly protected while allowing the flow of health information needed to provide and promote high quality health care and to protect the public's health and well-being. Pros and cons of paper records. Pros: not near as expensive to start as electronic records are. Medical professionals can change the medical record at any time, and it's easy to add documents to the patient's file. The cons: it can become complicated and eventually expensive to store the paper files because they're supposed to be stored for 7 to 10 years after the fact. Medical professionals can change the medical record at any time. I listed this as a pro and a con. Con because they can change it at any time. It's just written down on a piece of paper. They could white it out. At least with an electronic record, it'll be time stamped. Another con is handwriting. We all know that some people have horrible handwriting, so at least you don't have to worry about that with an electronic record. Since they have to be stored for a long period of time, it is easy to lose, destroy, or steal pages. Since they have to store them for so long, they will probably have to put them in a storage unit of some sort. That storage unit could flood or catch on fire or whatever else, and that would mean that they no longer have those records. Now for the pros and cons of electronic health records. Pros: all the records are located in one place. It will eventually be accessible from any location. They allow for the creation of patient portals. It improves the quality of care, and it timestamps when something is done to a patient. The cons is it's pretty expensive, especially to start up, and that they are connected to the internet. This is, I guess, could be looked at as a pro or a con, but in this situation, it's definitely a con because it could be, the internet is hackable, so your records have a possibility of being hacked. Okay, so how to ensure security and privacy. According to ironmountain.com, There are 6 ways for health organizations to help secure a patient's protected health information. One is to enhance the administrative controls. That means updating policies and procedures. That means running background checks on all employees and even guiding the employees through a very stringent privacy and security training process. Number 2 is to monitor physical and system access. So, this would mean creating physically inaccessible systems to unauthorized individuals. This would be providing identification and verification for anybody who uses the system. This is access the list of authorized users. This is supplying password and personal identification numbers and providing automatic software shutdown routines. As far as the passwords are concerned, they often have a security feature where it is changed every like 30 days, 30 to 90 days. Number 3 is to identify workstation usage. So this is like set privacy filters at each workstation and then to distinguish the different capabilities of each workstation. So some workstations shouldn't be allowed to access the ER if they're located in labor and delivery. Number 4, audit and monitor system users. Identify any weaknesses in the system, detect any security breaches or attempt at a breach, regularly audit all authorized users, and issue specified punishments to employees not following compliance guidelines. Number 5, employ device and media controls. So this would mean construct a security plan for data disposal, remove data from reusable hardware, track all reprocessed hardware, and back up all data from all hardware. Number 6, apply data encryption. Distinguish all data inside medical files through cryptography. Reliable electronic health record companies apply these enhanced security and privacy protocols. Perhaps the most important security protocol is data encryption, which causes the data to become unreadable to an outside source. So what happens if you violate HIPAA? The U.S. Department of HHS and OCR, also known as the Office of Civil Rights, are responsible for administering, investigating, and enforcing the HIPAA privacy standards. The American Recovery and Reinvestment Act of 2009 created a tiered penalty configuration for HIPAA violations. HIPAA violations can range from fines to jail time. For example, a fine for a first-time infringement by someone who did not know they violated HIPAA could be as low as $100, but it could also be as high as $50,000. If you were deceptive in your use of someone else's health information and you tried to sell it or transfer it somewhere else or profit from it in any way, then you could receive a fine as high as $250,000. You could also receive imprisonment, and that could be up to 10 years.
Here we will discuss electronic prescribing. Electronic prescribing also there are many benefits to e-prescribing. It reduces errors, reduces ineligibility, reduces safety issues, and improves quality of care. Sending prescriptions through a computer reduces errors such as ineligibility. It also reduces safety issues by enhancing the efficiency of the workflow. For example, When a prescription is sent, it is thoroughly checked, sometimes even through a medication decision support system. The quality of care for the patients is a main concern in the hospital setting. With the innovation of electronic prescribing, it allows the care of the patient to have a positive outcome of care. Without having e-prescription, there can be some adverse drug effects. There can be a drug interaction, allergies, dose error, and contraindications. Drug interaction occurs when the effect of a medication is altered when taken with food or even another medication. A medication allergy is a bad reaction to a drug such as fever, rash, etc. A dose error, for example, is a drug that is 10 milligrams and the doctor putting 100 milligrams in the computer. The computer usually knows what a patient can or cannot have. So therefore, when a number is extremely high on a drug, a flag will come up on the patient's chart. Along with all these drug problems, there are contraindications. Contraindications is a situation which is harmful to the patient. For example, aspirin causing Rye syndrome is a contraindication of a medicine. All in all, with the help of electronic prescription system, it helps prevent all these adverse drug effects. There are 6 typologies of e-prescribing: Type 1, Type 2, Type 2A, Type 2B, Type 2C, and Type 2D. In further detail, Type 1 is a bespoke system. It is developed to meet the requirements of a single hospital. Type 2 is the package application, and it is aimed to cater to the needs of various organizations. Type 2A, which is a standalone system, a system that is separate application, not connected to wider hospital information systems. Type 2B is modules within an integrated system that performs various functionalities required for prescribing and administration of a medicine, and works as a part of a larger health information system. Type 2C is functionality spread over several modules. It's like 2B, but this type of system also integrates into a larger health information system. Type 2D is specialty systems, which are designed to meet the needs of a specialty in healthcare. So you can see there are all different types of typologies of e-prescribing. There's not just one for one single use. E-prescribing, current and future processes. For hundreds of years, the written prescription has been the method of choice for physicians to communicate decisions on drug therapy and for pharmacists to dispense medication, while at the same time being a source of information for the patient about how to use the medication in order to maximize its benefit. Currently, the medical prescription is at the transitional stage between paper and web, and to adapt a traditional process to the new electronic era offers unique challenges. In 1983, the first electronic prescription was sent from a doctor's surgery to a pharmacy. The hypothesis of this project was that a computer in a physician's office would contribute to safer drug prescribing. With the patient's medical history stored in a database, the physician can be alerted on contraindications and patient-specific warnings such as drug-to-drug interactions. The technology was expected to reduce medical errors both in prescribing and dispensing, and even address the problem of fake prescriptions. In addition, it was thought that electronic process would promote collaboration between the two professions of medicine and pharmacy and would increase efficiency. Several projects later, e-prescribing has finally taken off. In Sweden and Denmark, the majority of new prescriptions are now transferred electronically. In Sweden, more than 2 million electronic prescriptions were transmitted during the single month of December 2006. A national mailbox for electronic prescriptions allows patients to choose any pharmacy in the county and pick up their medication by identifying themselves at the counter. Patients may also store their prescriptions electronically for future repeat prescriptions. Stored prescriptions are also available for safe and secure mail delivery service. A new mandatory legislation allows patients to access a national database. Nearly 6.4 million individuals of their medication history over the last 15 months, and they may also give consent to prescribers and pharmacists to search the pharmacy register of dispensed medications online to ensure increased quality in the future prescribing and dispensing processes. The outcome of e-prescribing has raised efficiency levels both for prescribers and pharmacists. Problems with falsifications of e-prescriptions are non-existent. However, new types of errors could emerge and continuous quality surveillance is thus mandatory. The impact of e-prescribing on prescribing quality has not yet been measured, but will be the subject of a forthcoming study. The vision is to have a fully electronic process for prescribing and dispensing involving all physicians, patients, and dispensing pharmacists, allowing the patient increased influence, with improved quality in drug utilization and better cost effectiveness. As this chart shows, from 2015 to 2024, e-prescribing continues to grow year by year.
Hello, my name is Janet Bolin. My part of the presentation is on mobile technology, or mHealth. Mobile technology, or mHealth, is the use of smartphones, tablets, and other mobile devices to deliver health care and preventative health services. According to a recent survey, 83% of physicians in the U.S. use some type of mHealth for their patients. Mobile technology is really great for a physician, because maybe they are away from their office and they need to look up information on a patient. They can access it through their smartphone or tablet. And smartphones and tablets are lighter and easier to carry around than laptops. This can make the physician more mobile, and they are able to do their rounds and do their job more efficient. How healthcare providers use mHealth. They use it to access clinical information through mobile health apps, mobile enabled EHRs, and they do this using their tablets or smartphones. They're able to look up things quicker than having to run to a computer and look it up. They also use it to collaborate with care teams. They do this by using secure text messaging or secure emails and things like that. Being able to keep the team members informed a lot quicker is a great asset to a physician. Maybe they're busy doing rounds and stuff and they need to collaborate with the team. They don't have time to run down to their office or call them or whatever. They can shoot the team members a quick message about what's going on with the patient. They also use it to communicate with patients through the patient portals. Maybe they need to inform a patient of something that new that has came up with their health. They can send them a message to tell them either to call them, or they can send them a private message through a secure messaging system letting them know what's going on and everything. And then patients can also communicate back with them. They offer real-time monitoring of patients. They can use mobile technology to check patients' vital signs and stuff like that. Maybe the patient has got some kind of device that they wear that records their vital signs and stuff. Nurses and doctors will be able to see that through some kind of tablet or smartphone device. They also provide healthcare remotely, also called telemedicine. Telemedicine is a really great tool. Sometimes doctors need to collaborate with specialists, and maybe the specialist isn't in their area. They could collaborate with this specialist over telemedicine so they could offer the best care for their patients. Plus, it is also great for underdeveloped areas of the world. It gives the doctors over there the opportunity to get help from specialists here in the U.S. so they can offer better health care to their patients over there. How patients use mHealth. Patients can track their own health data through mHealth apps and devices like Fitbit. They can also access their clinical records through mobile-enabled patient portals, and they can also communicate with providers through HIPAA-compliant email and secure text messages. Having patients play a role in their health will help them improve their health a great deal. Using devices like Fitbit not only to track your activity but also what you eat and everything, it really gives you a big picture of what kind of health you have, and you can see how many calories you're intaking, how much fat, sugar, and you can help you to adjust your eating so you can eat better. Maybe you're trying to lose weight, or maybe you just want to stay healthy and stay fit. And a Fitbit type device is a really great way to do that. Also, Patient Portal is one of my favorite tools. I know when I go to the doctor and they're feeding me all this information about my test results and stuff, sometimes I don't remember everything and I'm like, what did they say? Well, when I get home, I can look up on my patient portal when they've put my information in, and I could see those test results. I could see how, if my blood pressure was high, I could check my sugar, my cholesterol. I can do all that and just keep tabs on my health, and it makes me more aware of what's going on with my body. And also, another great thing is maybe I was in the office and I forgot to ask the doctor, about something. I can shoot them a message through the secure text messaging or email, and then they can give me a reply back. It's better than having to call them and sit there and wait for them to return a call. Sometimes that ends up just being a game of phone tag. This way, I don't have to wait for a phone call. I can just wait for them to send me my message. Benefits of mHealth. One of the benefits of mHealth is better point of care coordination. This is achieved by allowing the doctor or nurse to monitor their patient after they are discharged. Being able to communicate with them to make sure that they understood the discharge instructions and that they're properly taking their medication and getting plenty of rest once they are home. This will help decrease the number of readmissions. Another benefit is seamless data flow. Mobile technology is helping by making information move through the network faster and more efficiently. This gives doctors more control over the data that is shared. They also don't have to worry about misplaced papers, files, or folders. It will always be there on their tablet or smartphone device. Another benefit is direct patient management. Doctors and nurses can now check on their patient by the patient using a device that they wear that will record their vital signs and other important health data. It enhances physicians' efficiency. According to mHealth Statistics 2016, 93% of physicians believe that mobile health apps can improve patient health. It also helps by um, fewer mistakes that are made from ineligible handwriting. Another benefit of mHealth is increased diagnostic accuracy, and it is also provides convenience. It provides convenience by replacing bulky medical books. Healthcare professionals can now rapidly access information from their phone and tablets. When they need to look up something, they don't have to run back to their office and look it up in a textbook. They can now just search it on their tablet or smartphone device, and it makes them able to do their work more efficient. It also provides real-time communication. Doctors and nurses can now inspect their patient's condition remotely using a high-definition camera. They could do this when maybe a patient was discharged and they had surgery, and maybe the patient is concerned about the surgical site. The doctor or nurse can look at the surgical site um, with an HD camera and um, make sure that there's no infection or anything that needs to be done for the patient to have to come back in to the hospital or come to their office to see them. Or maybe the patient has some other type of condition that the doctor or nurse can look at through the camera. Problems with mHealth? Communication via telehealth services fall outside the realm of HIPAA. Device manufacturers and mobile app makers may be able to share patient information with third-party advertisers. With mobile apps, we have to be careful what kind of mobile app we use if we don't want our information shared with third-party advertisers. So just be aware that when you download a app to track your health and everything, make sure that you read to make sure that it's not going to be shared with a third-party advertiser and then you get bombarded with a bunch of spam. Medical and consumer device software may contain security flaws and may come under attack from hackers. I'm sure this is something that we'll be continually working on. Um, Updates are always having to be done for everything that has to do with technology because hackers are always finding new ways to hack into devices and stuff, and that's going to be an ongoing issue. Some network-enabled medical devices don't fit into the high-tech security breach notification requirements, and privacy laws outside of HIPAA may not apply to mobile health apps. Even though with these problems, I still believe that mHealth technology is a great tool to use for our healthcare, and it can improve patients' health care. It can help the physician and nurses with their workload, and it can improve every day. There's going to be new things developing, and there's always going to be a better way to improve things as time goes on.